Serious, doctors of Reddit, what's that one case that made you go I'll never see that again? Women managed to mistake fake fingernail glue for her eye drops on her bedstand. She glued her eye shut, and yes, I somehow saw it again. Had a guy bouncing around clinics for probably years if not decades with non-specific back pain. It affects millions of patients, so the typical thing is rest, stretch, ice, maybe over-the-counter meds and go about your life. Well, when he got to us he mentioned he never had any imaging, so we do just a regular x-ray of his back. Sure enough, there's a small caliber bullet lodged near where the rib meets his spinal column. Apparently he had been near a drive-by shooting decades ago and was shot, but thought he just cut his back while jumping over something to get cover and never had it checked out. Never had expected an incident bullet. Probably never see one again. When I had an MRI for a back injury I felt a weird sensation in my right arm and leg. Apparently BBs are just magnetic enough to tug, but not enough to get ripped out. I didn't think they had actually penetrated into me, just left a welt. Inflated like a balloon from the hand. She worked at a machine that made plastic bottles. A hollow spike with a blob of melted plastic is jabbed into a mold and it injects air until it reached a preset cut-off pressure before the mold opened. While cleaning the machine cycled and caught her hand. The spike kept injecting air, but never hit the cut-off pressure, so it kept injecting. Fortunately it didn't hit a vessel. That would kill her. Instead the air dissected in the fascial planes and subcutaneous tissue and blew her up. Free air in abdomen. Both lungs partially collapsed. Looked like a volleyball. We reinflated her lungs with chest tubes. Gave her antibiotics, but she was fine otherwise. The rest of the air absorbed over a few days. Saw her in the office and she was a tiny thing. Unlike the huge obese person I had suspected on discharge from the hospital. A good friend is doing residency at a pediatrician's office that had a 6-month-old girl brought in because she had started growing pubic hair. Not fuzz. Straight up pubes. A nurse took note of the fact that the father was in his 60s and had enough insight to ask if he was taking testosterone treatments. Turned out that during skin-to-skin time he would lay his daughter on his chest, in the same spot he had applied his testosterone gel earlier in the day. My ex-husband was on full testosterone replacement after the birth of one of our kids. The baby and I both were exposed to the testosterone gel. I had to take a few meds, including one called Rayfemin, which is a terrible name. When I was on a gynecologic rotation, I saw a patient who needed a hysterectomy. A few days post-op she had a mild fever and abdominal pain. Ultrasound showed a collection had built up where her uterus used to be, so she was scooted back to theater to try and drain it. So the surgeons are carefully trying to reopen the wound, and not much is coming out for a while. Suddenly a little waterfall of pus starts gushing out of her vagina. There were liters of pus that had collected in this woman's abdomen and it was now spilling onto the floor of the theater. It looked like peri-peri sauce and smelled like death. Whenever someone says emergency theater in these comments I just picture everyone urgently running to put on a musical. Had a 30s male take a small caliber bullet to the lower back, coming completely paralyzed. Quadriplegia. Didn't make sense given location of wound meant only legs should be paralyzed. Paraplegia. On imagining, the bullet entered the spinal canal through a small opening, deflected and traveled up to the cervical spine, causing complete paralysis. All from some ass that shot up a BBQ. Locked-in syndrome. Paralyzed, unresponsive, could only move eyes, vitals and scans all normal. Shipped off to a big hospital with a neuro IQ. Haven't gotten a follow-up on her, only 35 years old. This lady came in and literally half of her face had been basically eaten up by basal cell carcinoma. Eye and everything were just gone. It was oozing blood. It had been this way for years, according to her. And the kicker, that's not even the problem she came into the hospital for. She had come in for an umbilical hernia as big as a basketball that had been there for months. And she started vomiting over the past week, so she finally went to the ED. I used to be in a registrar and had a lady come in because her heart monitor was going off. The thing is, she was covered in blood and had some small lacerations on her head and scalp. She wouldn't tell anyone why she was covered in blood, just insisted she needed her heart checked out. It was the weirdest thing. 70-something-year-old lady at normal health, walking, Reading. enjoying life with husband, a month or so prior to arriving at the university hospital where I was a resident. In that month she had rapidly went blind. Vision was first symptoms. Optometrist said everything was good, and no longer spoke nor ate. Husband distraught, obviously. Diagnosis of sporadic Creutzfeldt-Jakob disease, the human version of mad cow disease or scrapie. Prion diseases terrify me. I had a family of 3 that came in with progressive proximal muscle weakness and diplopia. Found out they tried home canning and all got botulism. It isn't every day you get to tell someone I called the CDC and they're flying in the antitoxin. Intubated them in the ED. They stayed in the ICU for about a month then went to an LTAC. I think one of the most interesting things I ever saw in the emergency department was the opposite of an episode of Untold Stories of the year that I literally saw a few days earlier. The patient in the episode is labeled as being acutely psychotic as she said something was crawling in her head. The doctor listens to her story and indeed believes his patient to be acutely psychotic. It was the physical exam that revealed that the botfly laid eggs on her scalp and they had to remove multiple insects from her scalp by using Vaseline to suffocate the bugs enough to extract them. My patient unfortunately had the opposite. She was a highly respected member of the community. She went on a holiday and got worms in her vagina. The gynecologist confirmed it for her under a microscope. Once the diagnosis is made, you are easily treated. She was given the requisite dosing of I think mebendazole. This is a one-time dose and sometimes you need a second to cure yourself 2 weeks later. Unfortunately, what the patient presented with was an acute psychotic break. She stated she had worms coming out of her skin. The only way to get them was to chew walnuts and rub the chewed walnut paste against her skin to extract the worms. She rhythmically rocked in the bed while her husband sat by. She couldn't stop rubbing walnuts and saying, "See, there's a worm." This went on for hours while we ran lab work, CT scan of her head, drug screen, even sent walnuts worms for pathology. No positive results. Eventually I had to admit the patient. The husband looked so defeated. I didn't feel comfortable with him having the strength to care for her. Don't know if I'll see that scene again. I had a patient who actually weighed 1,068 pounds. His BMI was higher than his nurse's weight. He was in his 30s. He came in with presumed septic shock and to get a 30 kg bolus would have been about 16 liters. He ended up with negative blood cultures and we never found out why his blood pressure got so low. He couldn't fit in any CT scanner. One thought was he got so large his weight collapsed his large veins, but we really have no idea. I'm a medical student, but I have seen 2 cases that I don't think I'll see again. First was a woman with freeze syndrome. Basically, every time she chewed, a small area on her cheek, right in front of her ear, would start sweating a lot and get red. The other one was a middle-aged man who got stabbed by his wife. It was actually the second time that he had come to the ER for being stabbed by his wife, and apparently his son had stabbed him once before too. He defended his wife by saying, "I made her mad," and refused to take legal action against her. You'll likely see him again. About 7 months ago, a young dude came into the emergency room with severe chest pain and shortness of breath. He was kind of skinny and lanky, so after thorough questioning and clinical examination, including an ECG, we sent him to get a chest x-ray to rule out a pneumothorax, which is when air gets trapped between the pleura and lung tissue. Anyways, after looking at the chest x-ray, we didn't see a pneumothorax, but we did see slivers of air trapped in the mediastinum, the part between the lungs. I asked him if he had vomited before the chest pains started and lo and behold he did. Dude got sent to the university hospital in an ambulance ASAP with the suspected diagnosis being pneumomediastinum DD, differential diagnosis, Behr syndrome, when one vomits so hard the esophagus ruptures. The university hospital confirmed the diagnosis to be Behr syndrome and the patient underwent emergency surgery. Actually still have his x-ray on a CD because I thought it was such an interesting case. I saw someone who stabbed herself in the neck to try and kill herself. She had a good crack at it and the knife went in from the base of her neck, through her trachea, past her aorta and into her pericardium. It took a few attempts to intubate her because the anatomy was so messed up. One attempt intubated her pericardial sac. Anesthetist here was once on call and had emergency trauma call. We usually get a few of these daily and are normally people who have fell from height or minor car collision. I came down to the resus department and was told it was an 18-year-old stabbing to the chest who had lost output. My first time dealing with this type of scenario, the adrenaline got going. I called for immediate help from the consultant on call. Multiple surgical and ED personnel arrived to be on standby. I work in a district general hospital, so we don't have facilities for cardiothoracic surgery. Our only hope was to cut open his chest, thoracotomy, and hope there was something we could treat. That is, pneumothorax, hemothorax. The young man arrives by ambulance with CPR in progress. There was blood everywhere, clothes soaked. He was blue and pale, vomit in the mouth. I took over the airway and intubated him. Airway secured while the ED doctor and surgeon started to quickly cut open his thorax and ED. Within 30 seconds of arrival they had cut away his entire ribcage, lifting it up like a flap. I could literally see his entire heart and lungs. Huge amounts of clotted blood fell out of his chest. His heart was palpated, but he had lost enough blood that further CPR was futile. Time of death: 3 minutes after arrival. Police took over for evidence. We all washed our hands of the blood, went back to work. I could not sleep that night or for a few days after. Nurse here. Got a patient from the ED. While she was down there, the nurse noted that her shirt was wet. She was assisting the patient into a gown, and when she removed the shirt there was an open stage IV breast tumor there. The wound's about the circumference of an apple or orange. The doctor asked her, "This doesn't just happen overnight. How long has this been going on?" The patient had no idea. This woman was definitely weird but didn't appear to have any psychiatric diagnosis. She lived with 2 brothers who obviously didn't have any reason to be looking there. She's probably dead now. I mean, I am as single as frick and have nobody looking at my tea, but I sure as heck would notice an open wound before it got that big. My dad used to work in the IQ about 40 years ago. A farmer came in who had all his skin ripped off by one of those high-speed belts. Surprisingly, he wasn't really concerned about that. The first thing he said to my dad was, my dong, is it still there? I just got married and we plan on having kids." By some miracle, the only place where his skin wasn't ripped off was around his genitals. When I was a med student, there was this lady who was admitted with shortness of breath and she was not conscious due to COPD and pneumonia. She looked old but not that much. So when she woke up, resident was taking the history and looked surprised. He said, "Are you really 106? She said yes, but it might be wrong, 2 years give or take. And resident asked if the old man was still around. She said he passed away 1.5 years ago. When we asked how did he pass away, she answered, he was 115 when he died. His senses were getting weaker and he was not feeling well, so he was moving very slow. So did he have a heart attack or something? Nah, he didn't hear the bus when he was crossing the street and died from traffic accident. She had really old daughters taking care of her, but they weren't very old looking either. Also, she was upset because we didn't let her die." Hopefully this is something I'm never see. I was swapping crazy IQ stories with a preceptor, and he had me beat by a mile with a story of a young, very obese woman who came in for sepsis. The source was a bunch of wood splinters embedded in the skin under her panis, but no one could figure out how the splinters got there. Eventually the story came out. The woman needed help whenever she tried to have penetrative sex with her husband, which they only did to try and conceive. She'd lay down on the kitchen table. Her mom would hold up one leg, her mill the other leg, so she was essentially in lithotomy, and her dad would shove a board under her panis to hold it up to allow her husband access. Apparently they called it the breeding board and decided to sand it down before using it next time. I thought my preceptor was joking me, but as the story progressed my classmates started freaking out, because she had a similar story from her days in L&D, on board, with a completely different family helping their obese still conceive. At a rural ED once and saw a lady that tried to plug her tractor's hydraulic fluid line, which had a leak, with her thumb, then activated it. Probably thousands of C worth of pressured fluid ripped through her thumb and hand. Pretty mangled. I'll probably see wounds like that, but unliked from someone thinking they can plug a hole like that with their thumb. My first patient experience in medical school was a doozy. Patient came in with chest pain, multiple previous MIs, looking like crap. He codes in front of us and we immediately start CPR. Being the med student, I was doing compressions. Halfway through the first round the guy starts groaning and grabbing at my arm. I assume that means his heart started up again, so I stop for a second and the guy goes totally limp. No palpable pulse. Restart compressions. Same thing happens again. This time they tell me not to stop. Apparently there was little enough downtime and the compressions were working well enough to perfuse his brain to the point of actually waking up a bit. Ultimately we sedated the guy, but for the first few minutes we had to hold his arms down so he wouldn't grab me. He was still groaning during that time though. Called the code about 30 minutes in. What's scary to me is I'd always have assumed that sort of response would mean they'd live. The heart would restart. You have been visited by the road savvy chihuahua. You will have good fortune behind the wheel and an accident-free life, but only if you comment drive safe, papa.